So let's talk about using an AED, a defibrillator, on a child or smaller frame person. We're going to recap Child Cpr and then we'll show you how to introduce the AED if we're a sole rescuer. So watch all the way through to the end. We're going to check the area for danger. We're going to check for response. We're going to see if they respond by pressure, by talking to us, make a loud noise next to them to see if they wake up. No response, I'll probably shout for help. I will then open the airway by doing a head tilt and a chin lift, and I will look, listen and feel for breathing, normal breathing in 10 seconds. This casualty is not breathing, so because it's a child, I'm going to do 5 rescue breaths. After my 5 rescue breaths, I will then do compressions using the heel of one hand. Now I've got no scissors with me, so I'm just going to remove the casualty's jacket because I can unzip that and do compressions with the heel of one hand, 30 of those at the speed of 100 to 120 beats per minute. And then I will go and do 2 rescue breaths. And I'm going to do that 3 times, 3 cycles, which is 1 minute. After a minute, if this casualty hasn't woken up and I'm still by myself, I'm going to leave them to go and make a phone call and to grab the AED that I have available. I will come back and I will turn the AED on.
Apply pads to patient's bare chest.
I'm putting my gloves on, my PPE, and then I'm going to get the scissors and cut their t-shirt off so I've got a naked chest. I will then put the pads on. Now this is a bit that's different. On a child, we place the pads front and back. If you remember, on an adult, we had them on the clavicle, the collarbone, and on the left-hand side of the body. So the shock will go through the heart. We can't put them like that on this child because their frame is too small. And that will mean the shock will go over the heart rather than through it. So we're going to place one on the front of this child, and then we're going to place one on the back, so the shock will go through the heart. When the pads are in place, we're going to plug it in and listen to the instructions.
Analyzing heart rhythm. Do not touch the patient.
So it's looking for a shockable rhythm. So we're making sure we're not touching the casualty as it's doing that.
Shock advised. Charging. Stay clear of patient.
Now as it's charging, we're making sure everyone is standing back. We're getting ready to push that shock button when it flashes. We're then going to push that button when it tells us to. And afterwards, we're then going to carry on with our 30 compressions and 2 rescue breaths. Now, if I had a helper there with me, we do not delay in calling the emergency medical services. If there's a helper there, we know this person is not breathing, this child's not breathing, we send them to go and get an ambulance straight away and come back with that AED. Don't forget to hit that subscribe button as well, so you don't miss out on any of our videos. And please comment below